Good morning, everyone. Myself, Dr. Ragbi Patel, Assistant Professor from Faculty of Physiotherapy. So, today we learn the prehension. In this video, we learn what is prehension, the classification of prehension, different types of grip, and the functional position of wrist and hand. So, we start with the introduction. Prehension activity involves grasping or taking hold of an object between any two surfaces of the hand, that is, use of full hand or just use of finger and thumb or between two fingers. Thumb participate in most of the activities but not all the prehension activities. The prehension is classified into two types. First is power grip, that is full hand prehension. Second is precision, that is finger and thumb prehension. Now we see the difference between power grip and precision. The forceful act resulting in flexion of all fingers. The thumb acts as a stabilizer to the object held in the finger or palm. The phases of the power grip are opening of hand, followed by positioning the fingers, then bringing the fingers to the object, and followed by maintaining that static phase. Object is grasped to move through the space by some proximal joint. Thumb is generally adducted. Now, in precision, the skillful placement of an object between fingers or between finger and thumb. There is no involvement of the palm. The phases for the precision are opening of hand, positioning of fingers, bringing the fingers to the object. Finger and thumb grasp the object to manipulate it within the hand. Thumb is generally abducted. This figure shows the different types of power grips and the precision grip. Power grip includes the cylindrical grip, spherical grip, hook grip, and the lateral prehension. And precision grip includes the pinch grip, that is between the thumb and finger or between two fingers. So first we start with the power grip. Fingers function to clamp or hold an object into the palm. Fingers sustain flexion position that varies in degree with size, shape and weight of an object. Palmar arches around it. Thumb serve as an additional surface to finger, palm by adducting against the object. The different power grips are cylindrical grip, spherical grip, hook grip and the lateral prehension. First is cylindrical grip. It involves the use of all the finger flexors. The FTP works predominantly. Interossei muscles, primarily metacarpophalangeal flexors, adductor or abductors, work simultaneously. Thumb usually comes around the object and hold the object in static position. The flexor pollicis longus and the thenar muscles, flexion and adduction of the thumb, helps in adduction of the thumb. The abductor digiti minimi flexes and abduct fifth metacarpophalangeal joint. Opponent digiti minimi and flexor digiti minimi do opposition and flexion of the fifth metacarpophalangeal joint. The cylindrical grasp is typically performed with the wrist in neutral flexion and extension and slightly in ulnar deviation. Example of the cylindrical grip is turning a doorknob or holding a glass. Next is spherical grip. Most respect to cylindrical grips but greater spread of fingers to encompass the object. More activities of interossei for this spherical grip. For example, holding a ball, where all the fingers spread around the ball and hold the ball in a static position. Next is hook grip, specialized form of prehension. Function primarily of the fingers. Major activity of flexor digitorum profundus and flexor digitorum superficialis. Load more distally to the FDP muscle and proximally to the FDS muscle. Thumb moderate to the full extension. It is in half flexion position. Example, carrying a briefcase. Next is lateral prehension. Contact between two fingers. The MCP, that is metacarpophalangeal, and the IP, that is interphalangeal joints in extension as contiguous MCP joints simultaneously abduct and adduct. Extensor musculature are predominant in this lateral prehension. Example, holding a paper between the two fingers. Next type is precision grip. It requires much finer motor control and more dependent on intact sensation. In two-jaw chunk, one jaw is thumb, adducted or rotated, and second jaw is by distal tip, the pad or the side of the finger. There is three varieties of precision grip. First is pad to pad prehension, second is tip to tip prehension, and third is pad to side prehension. First, pad to pad prehension. It involves opposition of pad or pulp of finger to pad or pulp of finger. The pad has the greatest concentration of tactile corpuscle. The metacarpophalangeal and proximal interphalangeal joints of the fingers partially flexed. Distal interphalangeal joint is extended or slightly flexed. Thumb, the MCP flexion, abduction and rotation occurs. MCP and IP joint partially flexed or extended. Example, holding a forceps. Next is tip to tip prehension. Muscle activity almost similar to pad prehension with some key differences, like interphalangeal joint of the finger and the thumb have range and force to create full flexion. The MCP, that is metacarpophalangeal joint of opposing finger, deviates ulnarly. Example is holding a pen. Next is side to side prehension. Key grip or lateral pinch between thumb and the side of the index finger. Thumb more adducted and less rotated, less precise form of precision handling. Example, holding a key. So next is functional position of wrist and hand. The functional position of wrist is wrist complex is in slight extension, that is up to 20 degree, and slight ulnar deviation, that is up to 10 degree. The fingers moderately flexed at MCP joint, that is metacarpophalangeal joint, up to 45 degree, and proximal IP, that is interphalangeal joint, up to 30 degree, and slightly flexed at distal interphalangeal joint. In this position, in which all wrist muscles are under equal tension, this figure shows the normal functional position of wrist and hand. Thank you.